It's my feel-good breakfast show.
Welcome back. You're live with Expresso. Thank you so much for tuning in. In fact, this whole month, thank you for dialing into Mental Health Awareness Month, an opportunity for all of us, I think, to show our support, most importantly, and efforts for those who suffer from mental disorders. Schizophrenia, certainly, I think, from my limited understanding, sits on the more severe end of that spectrum. Debilitating behavior. It's a disorder that affects more people than you would know, but in a very dramatic way, in the way that they feel, in the way that they act, and of course can engage with society. It is a chronic mental disorder that makes it difficult for a person to distinguish between real life and their false perceptions of life. But thankfully, I've got two professionals here to guide me through my education process and helping us understand schizophrenia, psychiatrists Kerryn, Armstrong and Imthiaz. Hoosen, guys, thank you so much for joining us. I have to again reiterate how important it's been for us to use this platform to educate ourselves. I feel like I understand so much more about the human condition now. I think many of us feel like we sit somewhere on the spectrum, and we use that term, we've used it a lot. But when we talk about that, schizophrenia obviously sits on the far more extreme end of that. Maybe between the two of you can first explain to us, what is schizophrenia in the professional term?
Okay, yeah, great, thanks. So as you mentioned, it is a chronic disorder. It's also considered one of the more severe mental health disorders. And perhaps in a simpler way, we can consider it to be a disorder of the mind. So it affects how you think, how you behave, how you perceive things. So I think one of the things also to bear in mind is that, unfortunately, there's also been a lot of misconception associated with schizophrenia, and hopefully we'll clear up some of that.
We love to use that term conversationally.
Yeah, so hopefully we'll clear up some of that as we go through the morning. But it's a condition that is quite complex, and even for mental health practitioners, it's a complex condition that one really needs to have a good understanding to delineate, what is schizophrenia from what are other conditions, and we'll look at some of that a little bit later. But in essence, it's a disease or disorder of the mind.
Are there subtypes that, because I know you want to be able to label something so you can treat something, but it's, as you've pointed out, becomes quite a murky pond when you're now trying to identify what is actually going on in a very complex human brain. What are the subtypes of schizophrenia? How can it play out in its various forms, do you think?
Well, as Dr. Hoosen mentioned, it's an incredibly complex disorder with this whole spectrum of presentations. So nowadays, we are moving more and more from categorizing into these strict subtypes that you mentioned. In the past, there were these categories: paranoid schizophrenia, disorganized, catatonic, but in the new classifications and the new diagnostic systems, we are moving more and more away from that kind of strict subtype diagnostic categories, because they found that there was such a big overlay with individuals between these categories. So the subtypes weren't really found to be that helpful. Yeah. So more and more, we're now looking at the individual as the person. What are we dealing with here? What are the symptoms? What can we treat? And recognizing that within the whole schizophrenia kind of diagnostic categories, there are so many types of presentations, and yeah, even the term within itself, we're now looking into researching more and more, is the schizophrenia label actually an umbrella term for many different types of presentations and disorders almost within that umbrella term?
I think you've hit the nail on the head. Every expert that we have spoken to, who has spoken with such empathy, which is the most amazing part of this whole journey for me, has spoken about dealing with the individual. Maybe this Mental Health Awareness Month has been about purely casting a light on that, on how far our ability to treat has leapt forward. What are some of the major risk factors, before we look at identifying the broader spectrum, what are some of the major risk factors that you've come across in your work?
Okay, so I think firstly, to emphasize that there's no one specific cause, because people often ask us, what's the cause of schizophrenia?
What happened?
Yes, so the first thing to say, there's no one specific cause. So it's really an interaction probably between genes or genetic and the environmental factors. So we know there's a very strong family history, or genes play a particular role. So for example, in the general population, schizophrenia will be about 1 in 100. But if you have a
It's
parent...
quite high.
Yeah.
Yeah,
In itself.
that is one.
It is.
But for example, if you have a parent with schizophrenia, your risk then will be 1 in 10.
Wow.
If you have an identical twin with schizophrenia, your risk is 1 in 2, about 50%. So clearly genetics plays an important role, but equally so are environmental factors. So there are environmental factors, for example, birth trauma. So we know factors that compromise blood flow to the baby's brain will then increase the risk of schizophrenia and other mental health conditions later on. For example, if the mother might acquire an infection during pregnancy, that can affect the development of that fetus, that will also increase the risk. There are other common conditions, for example, neglect, child abuse at a young age, that increases the vulnerability, not only for schizophrenia, but also for a host of other mental health conditions. And then very importantly, substance misuse. I think it's very controversial, particularly with cannabis, but we definitely know that drugs and alcohol play a role.
There is a relationship there.
Yeah, and particularly the stimulants, so things like cocaine, methamphetamine, which we should call tucking in Cape Town, cat. Those types of drugs can induce what we call psychotic symptoms. So these are symptoms that can mimic schizophrenia. But usually if it's a drug-induced state, they settle down within a few days.
Subside, yeah.
But in some individuals, it can trigger the onset of schizophrenia, which means that even if you stop those drugs, it will then continue. And cannabis, particularly controversially, because we've sort of legalized
Now
cannabis.
it's been
Yeah.
partially legalized.
Partially legalized.
Partially it
But
is.
there's also good research that shows, particularly in teenagers, where there's been heavy use of cannabis in teenage years, that increases the risk of schizophrenia. So it increases your risk 6 times,
Wow.
Wow,
if you've been a heavy user.
significant.
And particularly, we also have to look at the strains of cannabis, particularly the stronger types of cannabis. So locally we have things like cheese and skunk. So it's the more potent form of cannabis also increases the risk of the onset of schizophrenia. So there's definitely several risk factors. And then, as Kerryn mentioned earlier, there's this quite wide range of conditions. And we call it, there's an umbrella term called psychosis. And I think it's easier to consider psychosis as an umbrella term, with schizophrenia being one type of psychosis.
One of those manifestations. Well, we're going to get into, I think, some of the red flags that we as family, as friends, can delve into, but I think most importantly continue with a sense of empathy in relating to people who are going through this particular journey in their own lives. That's what Mental Health Awareness Month is actually about connecting, removing the stigma, some of those misconceptions, which we'll get into in just a moment.
It's my feel-good breakfast show.
We are talking about schizophrenia, probably the most nuanced of our discussions around mental health, being Mental Health Awareness Month, but hopefully we're going to continue these slots throughout the year. It has been enriching, to say the least, to explore these very dynamic topics. And we've got Dr. Kerryn Armstrong and Imthiaz Hoosen, two incredible human beings who have opened my eyes certainly to a lot of the misconceptions I've had. And I'm lucky enough to be in a very informative space. So I would imagine these misconceptions are rife. Certainly in your field. Kerryn, I'm going to start with you. From a personal perspective, someone going through this probably most severe states of psychosis, if I'm using the term right, what do you experience in the umbrella sense of schizophrenia? How does a person feel in one of these spaces, in this condition?
So people with schizophrenia experience a wide range of symptoms. Typically, there is a disconnect with reality, so difficulty distinguishing what is real and what is not real. So people start to often hold beliefs that are not really true. So they may start to feel like people are watching them, people are following them, people are after them, or start to believe that they have special powers. There's a whole range of symptoms that go under the term delusions, which is a fixed false belief that people hold and really believe that these things are happening. So,
Would these interjecting, would these push as far as actual hallucinations? Will people actually, the mind conjure these in the form of a vision, in the form of a voice, or is it a belief that these things are there? How do you draw that line?
certainly, so both of those are symptoms. So
Wow.
those are what we call the positive symptoms of schizophrenia. So delusional beliefs, which are these fixed false beliefs in something that is not really true. And also people experience hallucinations, which are perceptual disturbances in the absence of any external stimulus. So hearing voices that are not really perceived by other people, are not really there, seeing things that are not really there.
It's terrifying.
Absolutely terrifying. And, you know, often people are, it's extremely anxiety provoking, people get scared, so quite a disturbing space to be in. And along with those symptoms often go really odd behaviors, doing things that seem a bit odd or bizarre, speaking in a way that doesn't really make sense to other people. But often also a person may start to withdraw, become more and more isolated, no motivation to do things, often really lacking the motivation even to get up and look after themselves, you know, washing.
Just living in that inner space, that trap.
For sure. So as you can see, really disabling symptoms.
I understand the severity of it now, and it really does kind of bring to bear how difficult it is for someone in a space with someone living with schizophrenia. I've got to ask, split personality, that's what we love to throw out there, and I think Hollywood hasn't, you know, is either aided or misguided us. Is that a part of the schizophrenic spectrum? Does split personality disorder actually exist?
Yeah, I think, unfortunately, it's a Hollywood misconception. Look, I think when we talk about split personality, so there's a condition which is incredibly rare, but it's called multiple personality disorder. It's not really related to schizophrenia, and obviously it's, you know, something great in terms of Hollywood.
Yeah, it makes a good movie
No,
script.
you're right.
Yeah.
It's also quite a controversial sort of diagnosis, and I think sort of also brought to the fore by that movie Split recently.
I've been seeing James McAvoy doing a brilliant job of displaying this.
Yes. So really it's not about split personality as such, but maybe the split, as Kerryn also mentioned earlier, really is between sort of what is real, the real world, and what is that individual perceiving, and maybe we will sort of think about this as the fantasy. So they may believe certain things, or see certain things, or experience certain things that's not true. So there's a split between reality and fantasy, or their perception of the world.
And the world is in itself crazy at the moment. So I would imagine, you know, there are so many external factors that can drive this. How do you go about identifying this, not just as a doctor in this space, when there are so many opportunities to misdiagnose, when so many other mental disorders can kind of feed in and out? For a family member, I think, especially for a parent, how do you identify, how early can schizophrenia first exhibit? And what are some of those telltale signs that this might be something more than just depression and anxiety, which needs extreme treatment immediately anyway? But when do you think, you know, because one, you can phone a helpline and get help, another, you need to see a doctor. How does it exhibit?
Okay. So I think firstly is identifying some of the symptoms which Kerryn mentioned, but where schizophrenia also becomes a little complicated, there's something called a prodrome. Now, even us as professionals, sometimes we get caught out in the prodrome, and the prodrome is where the symptoms and the signs are very subtle. So sometimes patients might get diagnosed with anxiety disorders or depression, but later on, a few years later, the full diagnosis manifests. So for example, they might develop the hallucinations, the delusions later on, and then we look back and say, oh, well, actually that anxiety,
the echoes then, yeah.
That's right, that was actually all part of this condition of schizophrenia. So we call it a prodrome. So I think for family members and for parents, one of the key things is a change in behavior. And typically when we look at when does schizophrenia present, it's usually in the late teens, early 20s, particularly in young men. They tend to present a bit earlier. And
can it exhibit in childhood?
It can, but it's very unusual. So for example, for schizophrenia to present before the age of 14 or 15 is more unusual, but sometimes they can have more subtle signs. So for example, a bit of motor incoordination, they come across as being a little bit clumsy, they might display slightly odd behavior, but not really clear enough for us to make a distinct diagnosis. And sometimes it even overlaps with a condition called autism. So some patients might be sort of diagnosed with autistic spectrum disorder only later on then to develop schizophrenia.
You were saying even epilepsy can be feeding in and out. I'm now seeing everything that we've spoken about over the last month on one 360-degree spectrum with the human condition sitting firmly in the middle. We're going to talk about treatments and how we can, as a family and as partners, support in that process, and especially what we first need to do. And we'll reiterate some of the resources for help that just across the broader range of mental disorders as well. I'm going to just reiterate for the South African Depression and Anxiety Group, and we are not talking specifically to those who are suffering from schizophrenia, but anyone within that broader spectrum of depression or anxiety. There are people to talk to and people who can help you in that space. 0800 456 789. But we're going to continue our focus on schizophrenia specifically with the doctors in just a moment.
It's my feel-good breakfast show.
Welcome back. You're live with Expresso as we continue and wrap up a very important conversation around schizophrenia. Doctors, thank you so much for shedding some light on the darkest corners of the mind. And I don't say that lightly, because this really does bring to bear how devastating mental disorders can be in their most extreme form. Let's talk about treatment. Once we have felt this within ourselves, is self-diagnosis and taking that step, is it possible when you are caught in the grips of schizophrenia? Is it something that requires an intervention? How do we take the first steps towards treatment?
Yeah, so I think the first thing is that when somebody's in the grips of psychosis, it's often very difficult for them to acknowledge or to understand that they're probably going through a difficult period. So there's something we call insight or understanding. So many patients at that particular point in time lack that understanding. So they really need the intervention often of family members or friends to alert them there's a problem and to take them to a mental health professional to get the appropriate help. And I think particularly with schizophrenia, we would suggest that they actually go and seek medical attention from a doctor. Because when we're talking about treatment, the mainstay of treatment is really medication. So yes, psychological therapy is important and other types of therapy is important, but in that initial stage is really a type of medication which we call antipsychotic medication, which is
short-circuit the psychosis.
Yes, so it sort of interacts at the level of the brain chemicals to assist and to calm down those thoughts and to calm down, because often patients present with agitation or disturbed behavior. So it's to assist in helping to calm them down and also to redress some of those psychotic symptoms like the hallucinations and the delusions. So that's, I would say, is very important. Another very important aspect is that once somebody settles down, is to really maintain that medication. And this is really a struggle, again, when you're dealing with young people and having to say, please stay on your medication long term. But there's a lot of data that shows individuals that stay on the medication long term really have a good outcome.
How successful is treatment?
So again, it's individual, as we were saying. The individual's response to medication is an individual process, and also the prognosis differs between different cases. So there are different kind of spectrums of struggles that people have, and also differences in regard to ultimate prognosis. So in about 20% of cases, there can be an extremely favorable prognosis. So on the correct medication, a person can really go back to living a really functional life. In other cases, a person may, even on medication, experiences relapses, especially at stressful times. And there are people who really struggle with progressive decline and struggle finding the right medication. But I think one does need to emphasize that the earlier one can start on medication, the better the prognosis. So the longer the period of untreated symptoms, untreated schizophrenia, the worse the ultimate prognosis is. So it seems that the disease itself almost develops the longer a person remains untreated. So early intervention with appropriate treatment, support from family, there's a high chance that one can go back to living a really functional whole life.
I suppose then maybe I'm beginning to think that the important conversation here is as much to the families and the support structures around. Maybe both of you can round off now with some advice for families and for loved ones, partners that are going through this with their partners or their loved ones in that space. How would you suggest, or what would you say is the most important thing to bear in mind?
Yeah, so look, I think firstly is compassion and care and understanding the condition. I think a very key important aspect of part of this is many patients are perceived as being lazy, or they're perceived as maybe not having very serious illness because you can't see it externally. but bear in mind that this is one of the most disabling conditions. It's considered one of the top 10 disabling conditions in the world.
Wow.
So it's for family members to understand that, and that individual may have some limitations. So with that understanding comes a degree of compassion rather than criticism and a negative interaction. And I think if family members can bear that in mind and then offer that support and assistance, and can be practical assistance as well. So making sure you take your medication, making sure you attend your appointments, making sure that there's a conducive environment to support that individual. That's very important.
Yeah. And I think from my side, the important message is really get help soon.
Yeah.
So if you're noticing, as Dr. Hoosen said, you know, any changes of behavior, a person acting quite suspiciously, starting to withdraw, you know, get them to the doctor. Because something importantly that we haven't mentioned yet is that there are many different medical conditions that can present in similar ways to schizophrenia. So getting to the doctor, a person needs a full medical workup to check out, you know, drug tests, substances can mimic it. So get the appropriate help, have a workup, you know, make sure that you're getting a correct diagnosis, and then start on medication as soon as possible, really, I think is the important message. And, you know, there's so many organizations out there that can support a person getting back to full function. And, you know, really there is the potential to live a really full, healthy life.
Completely. And I would say to families, just be strong and be brave through that process, because they will need you to be exactly that. And hopefully this has enabled you to feel a bit more educated and empowered in that process throughout this month. In fact, in all spaces where we are dealing with the mind, we know that it can be one of life's greatest challenges, but there is help. No matter how extreme the condition, there is help. And if you are suffering in any way from depression or anxiety, please give the depression and anxiety call, the hotline, a call 24 hours a day. They're available 0800 456 789. That's 0800 456 789. But again, we have to stress, if you feel that you might be suffering from schizophrenia, if any of these symptoms are exhibiting, or if you are a family member who a light bulb moment has gone off this morning, make sure that you seek medical assistance. Go and see a doctor.